I'm Dr. Libby Pushparajan, consultant neurologist, St. Gregory's Medical Mission Hospital, Parimala, Tiruvalla. Today I will be talking on what is epilepsy and seizure and how do you know if you have epilepsy. Epilepsy is a neurological disorder which affects the brain. It is a tendency to have repeated seizures. And this tendency can be long term, but if the seizures are controlled, a person can have epilepsy, but still he may not have active seizures. So, what exactly these seizures are? As we know, our brain is the control center of the body. It has millions of cells called neurons. Neurons fire chemical messages to make our bodies work properly. Sometimes neurons may misfire and the chemical message gets mixed up. This can cause a seizure. Seizures are usually brief and sudden disruptions to the electrical activity in the brain. Seizures start in the part of the brain or happen in both sides of the brain at once. What type of seizure happens depends where in the brain the misfire happens. Talking about how one knows if one has epilepsy, when you first had a seizure, you must have been taken to the hospital. And this seizure could be either a generalized seizure in which you get jerking of your limbs, frothing from your mouth, tongue bite, or incontinence. Or it may be something like a partial seizure in which you may have just staring spells, or some chewing movements, or some tonic posturing of your limbs. So when you are taken to the hospital, you will have to undergo tests such as EEG, a CT scan, or MRI to make a diagnosis of epilepsy. And the doctor will assess the risk if you will have more seizures. And your medical history also plays an important role in the diagnosis of epilepsy. Many people have normal tests and scans, but epilepsy can still be diagnosed. In about 50% of cases, the cause of epilepsy is usually not known. Remember, anyone can develop epilepsy at any age. To help in accurate diagnosis, witness is important. Try to get as much information as possible from anyone who saw the seizure. And video recordings of the event can be extremely helpful in making the diagnosis. Thank you.